there's many peptides. So about 10 years ago, I started using some peptides in medicine. Everybody's probably using one, and it's glutathione. So GSH,
Right.
glutathione, is a tripeptide that everybody knows about, but a
Hmm.
lot of people don't understand that that's a peptide when they're talking about the traditional realms. But there's other ones. So I began using something called thymosin alpha 1.
Uh-huh.
And I loved thymosin alpha 1 because it really helped a lot of these people with these inflammatory conditions. Because, when you're talking about chronic disease and when you're talking about mold and mold toxicity, it causes oxidative stress and we're causing inflammation throughout our body. And
Exactly.
because of that, we have to have something that helps turn down that inflammatory markers and those inflammatory markers. So I started using thymosin alpha 1 and melanotan 2. Those were kind of my two key ones that I
Uh-huh.
use all the time because melanotan 2, although it might make you dark, it's really a great pathway through the melanocortin system in decreasing an inflammatory response, including ACTH. It helps modulate that. So the ACTH, the MSH, all the things coming down from the hypothalamus, it really helps to dampen and really helps to control some of that inflammation and some of the neuroinflammation. That's not one of the ones that we call a neuropeptide a lot of times, but it really does help to bring down neuroinflammation. So that's why I got so turned on to peptides. As time went on, we started introducing more and more peptides all along. And you probably know one of my favorites that now is LL37 because
Mhm.
it works so tremendously with our Lyme patients.
Right.
And so I love it and what it does for our Lyme patients. But it's not just our Lyme patients. I'm finding all these other people with other viral vectors, and it really helps them to mediate that insult from those different vectors, either bacterial, viral, parasitic. It really helps all of them, and I love it because it goes in conjunction with other medications or other antivirals that are homeopathic or whatever you want to use. It goes along with all of them. So it doesn't matter what your modalities are. And we've spoken a lot. I use multiple modalities. So I'll use some traditional type medicine stuff. Then I'll use some more of a naturopathic approach, sometimes a homeopathic approach. It depends on the individual patient what
Right.
you're going to do. But I love peptides because they go along with all of it.